Every morning, Lexi asks her daughter the same questions on the way to school, looking for signs of COVID-19.
I mean, at least they're on top of it.
She fills out the screening form twice, once for daycare and again for school. Having any one of these symptoms could send her daughter home, but Lexi doesn't mind.
It's a season when people get colds, and it doesn't necessarily mean they have COVID if they're sick, but I guess it's better to be safe than sorry.
In British Columbia, the coronavirus screening list has recently been narrowed. Some symptoms that have been taken off the list include a sore throat, a runny or stuffy nose, headache, fatigue, and skin rashes. Many parents are now used to these forms, going through the checklist to screen for COVID-19. But some doctors say if we start to take symptoms off the list, like a runny nose or a sore throat, we could see a jump in the number of cases.
I do think that as we see the numbers rise, that a conservative approach is the wisest. We don't want to be, relaxing and taking our guard down while numbers are rising and rising. That's not the best time to be lax, in my opinion.
In Ontario, the checklist has not changed. The Minister of Health says she knows the testing lines are long and families are stuck waiting, hoping their child's runny nose or sore throat is not a sign of COVID-19.
We don't know exactly everything that it involves in terms of symptoms, so this will be an active conversation and we will follow up.
The lineup outside of Michael Garron Hospital was filled with families waiting their turn to be tested. Many parents say they understand why the screening list for school and daycare is so specific.
I think it's very difficult to say because, we don't know what COVID symptoms we're going to see in a child.
Some welcome the idea of a narrowed approach.
As a parent of two children who are going to trade runny noses, I think if there's any kind of medical credibility to that, I'd be all for taking runny noses off the list.
Many more are simply wondering how long they will be able to manage with all of the new rules.
Last year and the year before, when she was in kindergarten, almost the entire year she had a runny nose. So I'm trying to figure out the protocol now. Every time a child has a runny nose, do we have to go stand in a 5-hour lineup and then pull everybody out of school and work until the test goes through?
Catherine Ward, Global News.